Hi, doctors. The experiment we will learn today is acid-base imbalance in rabbits. As we know, the body fluid balance is essential for homeostasis, including volume, concentration, distribution, and pH. Acid-base balance is important to normal life. Many conditions, overload, deficiency, and disorder in the regulation of acid base will lead to acid base imbalance that changes the body pH and metabolism. Acid base imbalance is secondary to some disease or pathological process and makes the condition more serious and complicated. Therefore, the judgment of acid base imbalance is the key to treatment. Today, we will replicate acid-base imbalance and learn how to analyze it. So firstly, let me introduce experiment principles. What's acid-base imbalance, how to buffer or compensate it, and how to diagnose it. Okay, everyone, let's summarize about acid-base imbalance. Now, the simple acid imbalance divided into four types: metabolic acidosis, alkalosis, or respiratory acidosis or alkalosis. First one, metabolic acidosis is the most common type in the clinical practice. It's caused by primary decrease in bicarbonate with pH decrease. Now, when the patient suffers from acidosis, acidic blood will stimulate the respiratory center and make a hypervolatilization to decrease blood pressure CO2 and make carbonic acid and bicarbonate to carbonic acid at 20 to 1, so pH may be normal. Now, kidney. If no renal disease, the kidney will accelerate the acid excretion at the same time increase bicarbonate reabsorption, which will restore the concentration of bicarbonate. Secondly, when acidosis takes place, the most dangerous of acidosis is acidosis will make hyperkalemia, which will result in the fetal arrhythmia. Secondly, acidosis will inhibit myocardial contractility, and hydrogenase will make peripheral vasodilatation, and acidosis will inhibit the CNS. In the chronic acidosis, the patient will manifest the bone problems. Now, in the metabolic alkalosis, they are opposite, which is caused by primary increase in bicarbonate. For example, the patient may excessive take of bicarbonate or transfusion with blood, bunched blood, or the patient has a renal disease, which makes the acid loss from the kidney, or the loss from the stomach. Now, alkaline blood will stimulate. The alkaline blood will inhibit the respiratory center and make a hypervolatilization to make CO2 retention. So CO2 retention will make the ratio of bicarbonate to carbonic acid maybe at 20 to 1, but the hypervolatilization easily make hypoxia. Hypoxia will stimulate the respiratory center and opposite hypervolatilization. So the lungs compensation is incomplete. In the chronic metabolic alkalosis, you need to use the kidney to compensate. If no renal disease, the kidney will decrease the acid accretion and make bicarbonate out of the body. Now, respiratory acidosis is caused by the pulmonary disease, which makes CO2 retention due to hypervolatilization, so the lungs cannot compensate. In acute cases, the patient only uses hemoglobin to compensate. In the chronic cases, we can use the kidney to increase the acid out and increase bicarbonate reabsorption. It's similar to metabolic acidosis, but the patient with respiratory acidosis will manifest the serious signs in CNS compared to lack of metabolic acidosis. The pathogenesis include CO2 make vasodilation, and CO2 diffuse into BBB and acidic blood in the CNS and make inhibitory manifestations. When CO2 more than 18 mm of mercury, the patient will manifest CO2 narcosis. It's also named pulmonary encephalopathy. We will discuss in later, such as the chapter respiratory failure. We will discuss it. Now, the key point for the treatment of respiratory acidosis is improve ventilation to clean CO2 out. The last one is alkalosis. The primary changes is decrease in CO2 caused by hyperventilation. So similar to respiratory acidosis, we cannot use the lungs to buffet. In acute the patient, we have enough time waiting for the renal compensation. So acute patient mainly depend on hemoglobin and tissue cells. And chronic respiratory alkalosis can depend on renal compensation, how decrease the acid excretion and decrease bicarbonate reabsorption is similar to metabolic alkalosis. So sometimes maybe you only remember one of the reason or compensation. You will know the other types. Now, sometimes in the same patient, there are two or more simple acid-base disturbances exist. So you should know how many types acid-base disorder in the patient. 都是按 double. Now there are 4 simple types. So how many combination as a double acid-base disorder? Now let's have a try. First one, possible. Next one, possible. Next one, possible. And the next one, possible. Last one, possible. Finally, respiratory acidosis and alkalosis cannot coexist. So actually, how many double acid-base disorder? How many? Double acidosis, double alkalosis, one alkalosis, one acidosis. So how many combination? 5. So there are 5 double acid-base disorders. Now let's one by one. The first one, double acidosis caused by respiratory or metabolic. We name it co-consistent. Now, 2 type acidosis. So pH extremely decrease. Respiratory acidosis mainly caused by hypoventilation, and metabolic acidosis mainly caused by fixed acid overproduction or less excretion. So according to the equation, respiratory acidosis make CO2 retention, and metabolic acidosis make bicarbonate reduction. So the direction of the 2 parameters are opposite. They cannot compensate for each other. So pH extremely decrease, and they will make hyperkalemia. The second one is double alkalosis. Respiratory alkalosis caused by hyperventilation, so CO2 out. And metabolic alkalosis is caused by excessive loss of acid or excessive gain of bicarbonate. So the change direction of the 2 parameters the same. The change direction of the two parameters are opposite. So pH extremely increase and make hypokalemia. Actually, for the deltas, it's easy to identify double alkalosis or double acidosis because bicarbonate and carbonic acid are opposite. So in this situation, the patient will feel confused when bicarbonate and carbonic the change direction is similar or the same. For example, inconsistent acid-base disorders, for example, one acidosis, one alkalosis, for example, hypovolation makes CO2 retention. This is respiratory acidosis. Metabolic alkalosis, which caused by increased bicarbonate. After calculation, maybe pH is normal. Now, doctor, if you see pH normal, cannot tell you patient go home because primary disease exists, need you treated. Now, for the doctors, it's difficult to distinguish which one is simple or which one is a double acid-base turbulence. So how shall we do distinguish this is a simple or a double? How shall we do? We can use compensatory formulas to calculate. Later, I will tell you how to use the formulas. Now the second one, acidosis and alkalosis. The bicarbonate and carbonic acid are the same direction. So you feel confused. What is it? This is simple or this is a double? Because if this is simple acid-base imbalance, the other parameters maybe is the secondary changes after compensation. So if you don't know the primary disease, you don't know what happened. So need you calculation according to the formulas. The last one, metabolic acidosis or metabolic alkalosis. The patients, for example, you are a patient, diarrhea or vomiting. Vomiting will make bicarbonate decrease, and vomiting will make the acid out, and the diarrhea will make bicarbonate loss. So two factors coexist. One is make bicarbonate reduction. One is called bicarbonate increase. Maybe they are opposite and make pH normal. If this is your patient, I think it's most difficult to distinguish this is normal person or abnormal person. I think the double acid-base imbalance is not the most complicated. Which one is the most complicated? Triple. So how many types of the triple acid-base imbalance? How many? We know respiratory acidosis cannot coexist with respiratory alkalosis. So the first combination, respiratory acidosis with acidosis alkalosis. The second combination, respiratory alkalosis with metabolic alkalosis and metabolic acidosis. Now, the triple acid-base disorders indicates they are caused by disease or pathological process. They will make the patient get worse or complicated. As a doctor, you should know what happened in the patient and what type acid-base imbalance take place. You should know the primary disease. You should know how to treat. So the purpose of experiment is to replicate the acid-base balance, including acidosis or alkalosis. Secondly, observe the alteration of blood gas index, including pH, ABSB, CO2, and BE. Next one, just the type of acid-base imbalance, including simple, double, maybe triple acid-base disturbance. The last one, analyze the mechanism of buffer effect or regulation system. Now today we will choose healthy rabbit as experimental subject. The following are experimental materials and equipment, including BL420 biosynthesis, breathing transducer, pressure transducer, 3 cannula, and surgical instrument, and some solution. Now this is uracil as a general anesthesia. This is heparin to anticoagulation, and we will use two solutions. One is sodium bicarbonate as an alkaline, and the other is sodium dihydrogen phosphate as an acid. And this is a tracheal cannula. This is arterial cannula and the venous cannula. Now this is observed index including blood pressure, respiratory frequency, pH, pathophysiology CO2, pathophysiology oxygen, standard bicarbonate, actual bicarbonate, BE and AZ. Here this is the actual report for blood gas. Now this means the temperature. pH normal 7.35 to 7.45. The pathophysiology CO2 normal range 13.5 to 14.5. The pathophysiology oxygen, this is normal rate. And the other parameters need you understand and remember. The first one is bicarbonate, actual bicarbonate AB. Second one, standard bicarbonate. Next one, base excess BE and iron gap AZ. Now today we will use these parameters and analyze the type of acid-base imbalance. And all the blood gas parameters are from arterial blood. Okay, now let's learn how to operate. The first one, we should grab your rabbit with the body weight after general anesthesia and fix your rabbit on the table. Next one, make a medial incision in the neck and dissect the trachea and the artery and internal jugular vein bluntly. Next one, incubate venous, tracheal, and arterial cannula. Next one, inject heparin to prevent blood clotting and observe the normal blood pressure, respiration, and blood gas index. Now, this is overview of your rabbit. Today, you need to insert 3 cannulas. The first one, venous cannula. We can use it to inject acid or base to copy acid-base imbalance. Second one, we will incubate the tracheal cannula. We can use it to record your rabbit respiration frequency because the lungs is an important organ to buffer acid imbalance. The next one, arterial cannula. We can use it to record blood pressure and draw other blood out for blood gas analysis. So this is the first part as an animal preparation. After observation of normal parameters, we will replicate acid-base imbalance. First one, ingest sodium dihydrogen phosphate. This is acid to replicate metabolic acidosis, or ingest sodium bicarbonate as alkaline to replicate metabolic alkalosis. After observe blood pressure, respiration, and blood gas parameters, we will collect the trachea by forceps and replicate respiratory acidosis. And the next one, observe blood pressure, respiration, and blood gas index. And the next one, let's analyze the types of acid-base imbalance. So this is the simple procedures of your experiment. Next one, let's learn it in detail. Take a healthy rabbit. Hold the neck and the back skin with one hand. Support the buttocks with the other hand. Be careful not to hold the rabbit ears and weigh the rabbit on the baby scales with kilogram. Draw 20% urine solution at a dosage of 5 ml 1 kg and remove the bubbles. Cut the hair of the ears back by clipper. The marginal veins is located at the outer edge of the ear sac. Insert the needle into the vein about 1 cm and inject uracil slowly and complete the injection within 2 or 3 minutes. Use a cotton filament to stimulate the cornea of the rabbit. If the reflex is obviously slow or disappear, and the muscle limbs relax and the breath is deep, slow and steady, skin pain response disappear, which indicates successful general anesthesia. Place the rabbit on the operating table in supine position and fix the tooth with a rope and fix it on the hook of the table. Then fix the limbs. Tie the limbs above the joint with the rope and fix them on both sides. Stretch both upper limbs downward and backward and keep the neck straight. Cut the neck hairs with a caliper close to the skin, the rinsing from the lower jaw to the superior border of the sternum and both sides of the neck. Now this is the breastbone, the jaw, about 7 centimeters, and put the cut hair into the water of the garbage to prevent the hair flying anywhere. And wipe the operating fields with a saline and lift the night skin and make a middle incision about 7 centimeters with surgical scissors. Cut the skin carefully and slowly to prevent bleeding. The next one, cut the subcutaneous tissue in the same way. Prevent bleeding. This is the trachea, which is covered by the muscle, so you should cut the subcutaneous tissue and separate the neck muscle with the forceps and expose the trachea. Bluntly separate the muscle. You know the muscle is reaching the vessel. If you use scissors, cut the muscle, it will make bleeding. This is the trachea. The next one, bluntly separate the connective tissue between the trachea and the esophagus and thread a line. But the next step is to separate external drug we have learned it in the experiment of acute hemorrhagic shock in a rabbit. So here, I will only show you how to incubate the cannula. Firstly, clamp the proximal end. Secondly, tight the distal end. So we prevent blood flow and use the small scissors, make a little cut close to the line. Next, insert venous cannula towards the heart, which is filled with heparin. So in these cannulas, this is heparin. And tight it tightly. Well, next incubate tracheal cannula. First one, make a reverse T-shaped cut between the two cartilage and make a incision towards the hand. And use the cotton clean the tracheal. Next one, insert tracheal cannula towards the heart and tight it tightly. And fuse it together. And next one, separate artery. This is heparin. Fill the pressure transducer with heparin and remove an air bubble. Now ligate the distal end and prevent blood flow to the proximal end. Use the little scissors, make a little cut, close the line. And towards the heart, insert arterial cannula. And tight it tightly. And connect the pressure transducer to the computer and open the T-pipe. You will know the blood pressure. The next, from the venous cannula, ingest heparin 1 kg 1 ml to prevent blood clotting. So this is the overview of your rabbit. This is a tracheal cannula to record respiration. This is the venous cannula to ingest the solution or the drugs. And this is arterial cannula. We will know blood pressure and draw arterial blood out for blood gas analysis. This is normal blood pressure and respiration. Now this is blood pressure. This is respiration. Now connect the syringe to the T-pipe and make arterial blood out. Firstly, let's abandon the old blood and take the fresh blood out, about 1 or 2 ml for blood gas analysis. And quickly connect the tube with the cap without any air bubble in it. Now quickly use the machine to analyze the blood gas. Well, now let's replicate acid imbalance. Firstly, take sodium dihydrogen phosphate, 1 kg 5 ml. And remove the air bubble. We'll next ingest the acid by venous cannula. Please slowly ingest. The rapid injection will stimulate the vessel and make a rapid respiration. That will change blood gas analysis. See, after injection, the rabbit has the fast respiration. You see, from the slow and the rapid and the deep. It indicates something happened. Well, 10 minutes later, please take the second tube of blood for blood gas analysis. Now, firstly, abandon the old blood and take the fresh blood about 1 or 2 ml. You will get the second report of blood gas analysis. Well, the next step, take sodium bicarbonate 1 kg 5 ml. And remove the air bubble. Now ingest sodium bicarbonate by venous cannula. Please pay attention, ingest slowly. Otherwise, you will stimulate the vessel and change breathing. After injection, please observe the respiration and blood pressure. So you see the respiration slow down. Well, 10 minutes later, please take the third tube of blood for blood gas analysis. The last step to copy respiratory acidosis for clapping the trachea. About 1 or 2 minutes until the blood color in the arterial cannula became cyanosis. Blood in the arterial cannula became cyanosis. Let's take the full tube of blood for blood guys. Part 3 Experimental Results. Firstly, blood pressure and respiration. The first one is normal. Second one is after injection of acid. Now, after acid injection, we'll see the blood pressure decrease and respiration frequency rapid and deep. After injection of sodium bicarbonate, it's a base and the respiration became slow and deep. Now the last one, collapse trachea. The rabbit, I feel difficult to breathing. Metabolic acidosis or alkalosis, the lungs is important organ to compensate acid imbalance. Now, if there is a respiratory acidosis or alkalosis, they cannot use the lungs as a compensatory organs. And the blood pressure decreases sharply because acidosis will blunt the response of vessel to the vasoconstrictor and make vasodilatation. So in the serious cases of acidosis, the blood pressure will be decreased. This is blood gas result. Normal, acid, base, CO2 retention. Now after injecting acid, AB, SB are decreased, B more negative, AZ is increased. After injecting the base, pH increase, base including SB and ABR increase, BE is more positive. After clapping trachea, pH decrease, ABR, SB are decreased, BE more negative, AC is increased. So let's analyze what happened about your rabbit. What's the type of acid imbalance take place in the rabbits? Part 4 Discussion of experiment. Well, let's continue part 5 Guidelines for the diagnosis of acid-base disturbance. In general, the case history and clinical manifestations provide important clues, and the result from blood gas are determinant evidence for the diagnosis of acid-base imbalance. And the calculation of Ag value is helpful in differentiating the classes of simple metabolic acidosis and in the diagnosis of mixed acid-base disturbance. Actually, the diagnosis of acid-base imbalance merely depends on blood gas. We want to know this is normal or abnormal report. This is acidosis or alkalosis. What causes it? Metabolic or respiratory disorder. This is a simple or mixed acid balance. This is a double or triple. For the doctors, how do we know what happened in your patient? Well, blood gas result will tell you about this is normal, abnormal patient. If all the parameters are normal, so no blood gas, no acid imbalance. If some parameters are abnormal, maybe something happened in the blood gas. Secondly, pH will help you to determine This is acidosis or alkalosis. Next one, the case history. Primary disease will tell you this is metabolic or respiratory factors. And we can observe the secondary change, including partial CO2 and bicarbonate. After calculation and comparison, we will know this is simple or double or triple. Okay. The calculation of AZ will help you to determine the classes of simple metabolic acidosis, and will help you to identify the double or triple acid imbalance. So AZ is a very important parameter. Okay, next one I will tell you how to use the blood gas report and make a right diagnosis. First one, guideline. Now this is the blood gas report. pH, CO2, extra bicarbonate, standard bicarbonate, the base excess, and ion gap. Now you see some parameters, the report give you the normal rate, and some parameters without any average. Now, as data is shown the normal rate, AB and SB, the normal rate is from 22 to 27. So, AB, SB, and BE are decreased, and pH increase, CO2 reduced. So the first one, guideline 1, please use your pen, draw out the change direction. Which direction? The change direction. Which one high, which one down, and the degree of the changes. If it changes sharply, you can use a double arrow or 3 arrow to mark it. The first one, use your pen, draw out the change direction and the degree of the changes. Next one, please compare pH. The normal rate of pH in the upstream blood is from 7.35 to 7.45. So when pH is less than 7.35, it's acidosis. If pH more than 7.45, this is alkalosis. Now in the report, pH is 7.47. So what happened? Alkalosis. If pH is normal, it's undetermined, and a normal pH indicates 3 situations. The first one, every parameters are normal. This is a normal person. Second one, the patient has a simple acid imbalance, but after the compensation, so pH is normal. The last one, the patient is mixed acid imbalance, one acidosis, one alkalosis. They will offset each other. So for the doctors, abnormal pH will tell you will happen about acidosis or alkalosis, but a normal pH needs your analysis what happened. So only pH cannot tell you what happened. In fact, you need read other parameters, including CO2 and bicarbonate. So the guideline 2 will use pH to identify acidosis or alkalosis. Secondly, according to the case history and the primary disease, and to determine this is a metabolic or respiratory acid imbalance. Well, if the case history about the primary disorders and the patient has direct decrease in bicarbonate, or maybe the patient might suffer from metabolic acidosis. If bicarbonate increase with metabolic disorder, so maybe it's caused by metabolic alkalosis. If your patient has respiratory acidosis, it will directly make CO2 retention, so CO2 will be increased. Conversely, respiratory alkalosis, because high probability taking CO2 out, so directly reduction in partial pressure CO2. So the guide 3 depend on the case history and primary disease. But sometimes we do know the primary disease. We cannot ask the case history. For example, you are a patient in coma. So how shall we know? You cannot communicate with your patient. How shall we know what happened about the acid-base balance? You can use variable rate. Now, what's meaning? For examples, this is a report from your patient, but we cannot know any information of your patient. Now, we can use the formulas. What's the formulas? First one, we can calculate bicarbonate variable rate. Use the normal rate, subtract actual rate, and divide into average value. Now, this is your patient. The bicarbonate is 19.7. The normal rate is 24. So, actually, some bicarbonate disappear. But how many bicarbonate disappear? The percentage after calculation is almost or nearly to 18%. Similar to particle CO2, the normal rate, the average of CO2 is 40. Now the actual value is 27.3. So how many CO2 out? After calculation, the percentage of CO2 reduction is 31%. So compared to bicarbonate, CO2 seems sharply reduction. So even no information about your patient history, but after our calculation, we know the primary disease make the primary changes in partial pressure CO2. So something happened in the ventilation. This is the get 3. Ask history or primary disease to determine this is metabolic or respiratory. If no information, please calculate the variable rate and compare the percentage. Which one is the high rate? Which one is the primary disease? Well, the guideline for please compare the change direction of bicarbonate and particle CO2. Now, in the case of the simple acid-base imbalance, for example, we have 4 types of simple acid imbalance. If we can use compensation such as we can use the lungs or a kidney, we will make the CO2 and the bicarbonate change to the same direction. For example, if your patient is metabolic acidosis, the primary changes is bicarbonate reduction, but after the lungs compensation makes CO2 out, the particle CO2 also decrease. So the change direction is similar, not the same. Now, if your patient is respiratory alkalosis, which is caused by hypervolation and the CO2 decrease, the patient will use the kidney to accelerate bicarbonate elimination. So the level in the blood, including bicarbonate, will be decreased. So they have the same direction as a compensation. Now, in the patient, if the change direction of bicarbonate and the particle CO2 is opposite, definitely no compensation takes place because they are opposite. So this is a consistent mixed acid imbalance. For example, respiratory acidosis and metabolic acidosis, or respiratory alkalosis and metabolic alkalosis. The direction of bicarbonate is opposite to particle pressure CO2. So if the change direction are opposite, it indicates no compensation. Without any calculation about the compensatory formulas, the patient is mixed acid imbalanced. Now, if they are the same direction, please compare the degree of the changes with the formulas. The compensation principles not include the same direction. They have the compensatory rate. which can be predicted by the formulas. For example, in the metabolic acidosis, more bicarbonate disappear, the blood is more acidic. That will make CO2 out. So more acidic, more CO2 out. And the reduction in part CO2 can be predicted by the formulas, but it has a limitation. At most, CO2 can be decreased to 10. So compensation principles has three situations. First one, same direction. Second one is limited in some range. Next one, they have limitation. Now, if your patient has the same direction of bicarbonate and the part CO2, please calculate the formulas. If the degree of the changes within the formulas, the secondary changes is caused by compensation. This is a simple acid-base imbalance. Now, if the actual degree of the changes out of the range, and in this case, the secondary changes is not caused by compensation. The patient is the double or the triple or mixed acid-base imbalance. If the degree of the changes below the formulas, there are two situations. The first one maybe is acute. The case is the patient has not enough time to waiting for compensation. So this is simple. If chronic the cases has enough time to waiting for compensation. Even after compensation, the degree of the changes also below the formulas and indicates your patient is mixed acid-base imbalance. Now look at pictures. Now this is the compensatory rate calculated by the formulas is in a elimination. If actual variation of bicarbonate or CO2 is in this range, the secondary changes is caused by compensation. The patient is simple. Now, if out of the range, that means actual variation, the parameters out of the range, and in this case, it cannot be caused by normal regulation because the normal regulation has a limitation. If you out of the limitation, this is a miss. Now, sometimes below the compensation, the compensatory rate, maybe the patient is acute cases has not enough time waiting for the compensation. So this is simple. If your patient is chronic, the chronic means has enough time waiting for compensation. But even after compensation, the actual variation also below the normal rate. So it indicates it's not the simple acid-base imbalance. Actually, it's a mixed one. So when the change direction of CO2 and bicarbonate is the same, need you calculate formulas. Which formulas? Compensatory formulas to calculate the compensatory range and use the actual variation compared to the range. If within the range, the secondary changes is caused by compensation. This is simple. If out of the range, this is a mix. If below the range, in the acute one, because no time to waiting for the compensation, this is simple. In the chronic, even after the compensation is also below the range, this is a mixed one. The next one, please calculate AZ. You will know about high AZ metabolic acidosis. So if AZ is higher, you can identify high AZ acidosis among the double or triple acid-base imbalance. So it's easy for the doctors to calculate AZ. And you will know about this is simple or miss. As we know, respiratory regulation is the main compensation of metabolic acidosis. When the blood is acidic, the acidic blood will stimulate respiratory center and make the fast or deep respiration. We name it Kussmaul breathing. They will make airway ventilation increase and eliminate CO2 out. As a result, the part of CO2 in the blood will be decreased, so the blood can be maintain the ratio of bicarbonate to carbonic acid at a normal level. To say another word, the primary changes is bicarbonate, but after the lungs compensation, the CO2 will be changes secondly, so the ratio can be maintained at a normal level. pH may be normal, but CO2 bicarbonate are changes. As we know, the degree of respiratory compensation is proportional to the degree of metabolic acidosis that can be predicted by compensatory formulas. If there is a 10 mmol per liter of bicarbonate reduced after calculation, they will make a 12 mm mercury column CO2 decrease. Now this is the result, blood gas result after injecting sodium dihydrogen phosphate. This is acid. After acid injection, we will see the respiration became rapid and deep. It indicates the lungs begin to compensate. So after compensation, CO2 will be out and possible CO2 will be decreased. But in this situation, we do know the decrease in CO2 is from the compensation after metabolic acidosis or something happened in the lungs. So need you calculate the expected compensatory rate and compare to actual rate. Now how to use the formula cannula. Now according to the formula cannula, in your rabbit, now AB here, AB is 19.9. So after calculation, from the average decrease to 19.9. Actually, there is something bicarbonate disappear. So after calculation, how many millimole per liter of bicarbonate decrease? They will make CO2 out by the lungs. After calculation, when AB decreased to 19.9, the CO2 will be decreased for the 4.24 to 9.24 millimeter mercury column. This is effective compensatory rate after calculation. Now, to say another word, if the lungs is normal, if the bicarbonate decrease to 19.9, the lungs can make CO2 out and make a reduction in possible CO2 about 4 to 8. Actually, in your rabbit, the possible CO2 is 29. So from average decrease to 29, there is 12 millimeter mercury column CO2 disappear, because the normal lungs only can make CO2 decrease from 4 to 8. Now actually the CO2 decrease about 12. So that means 12 is more than an expected compensatory rate. It indicates normal lungs cannot make CO2 out decrease to 12. It indicates there is another factors make the lungs to clear CO2 out. This is not caused by compensation after metabolic acidosis, because normal lungs cannot do it. What happened? Abnormal lungs did it. What happened? Respiratory alkalosis. So the result of diagnosis after injection sodium dihydrogen phosphate is metabolic acidosis and respiratory alkalosis. The causes of metabolic acidosis may be from sodium dihydrogen phosphorate, and respiratory alkalosis may be caused by rapid injection, which will stimulate whistle and make a rapid struggle or rapid respiration. So the second situation, it indicates this is a double acid-base imbalance. In the clinical practice, the doctor should know the causes of acid imbalance. Now, for this situation, after coagulation, we know this is a double acid imbalance. So we can analyze what happened, what caused it. If you know what causes, you can treat it. Well, similar to metabolic acidosis, respiratory regulation is also main compensation of metabolic alkalosis. Now, in case of metabolic alkalosis, alkaline blood will inhibit respiratory center and make slow and shallow breathing, which will make hypoventilation, so CO2 cannot be out. As a result, partial CO2 will be increased. Carbonic acid in the blood will be increased too. So the primary disease make bicarbonate increase. After the lungs compensation, we can make CO2 accumulation in the blood. So as a result, the ratio of bicarbonate to carbonic acid can be maintained at a normal level. Maybe pH is normal. This is the result of the lungs regulation. So after compensation, you will see the CO2 changes, but this doesn't indicate the lungs has problem or disease. This is just a normal reaction of compensation after metabolic alkalosis. Now, sometimes you should distinguish CO2 retention come from the lungs regulation or come from respiratory acidosis. To say another word, the lungs compensation has a limitation because hypoventilation will make hypoxia, and when the particle oxygen less than 16, they will stimulate respiration and will make a rapid and deep breathing that will offset the respiration regulation of metabolic alkalosis. So actually, the lungs regulation is incomplete. Now, the degree of respiratory regulation is proportional to the degree of bicarbonate increase. According to the compensatory formulas, we can compensate after you ingest sodium bicarbonate. We will know what happened. Now, this is the situation you ingest sodium bicarbonate. As we know, sodium bicarbonate is the base. So base overdose of base maybe will make alkalosis. Firstly, pH is increased, so this is alkalosis. Now, alkalosis is divided into respiratory and metabolic. If this alkalosis is caused by the lungs, the CO2 will be decreased. Now, CO2 is increased, so this alkalosis impossible caused by respiratory alkalosis. It is impossible caused by respiratory acidosis. Now, because the pH is increased, definitely alkalosis takes place. If it's caused by metabolic alkalosis, the base will be increased, including bicarbonate. In this situation, AB and SB are increased. And there is another situation. This alkalosis is caused by respiratory alkalosis. But respiratory alkalosis, it means CO2 will be decreased. In this situation, CO2 increase. So it's impossible for the patient who suffer from respiratory alkalosis. So definitely 7.49, that means metabolic alkalosis. Now the evidence is AB, SVR increase, BE is more positive. Now CO2 is increased, is more than normal rate. Is this the compensation from the lungs or the patient has respiratory acidosis? We do know which situation, so need to calculate. So how to analyze it? Firstly, according to the formula, this is the compensation formula in the case of multiple alkalosis. Now the patient AB is 16, it's 13.6. 13.6 minus 24, this is average. So after calculation, there is 12 millimole per liter bicarbonate is increased. After the lungs compensation, the lungs can make CO2 retention and make increase in the partial CO2 about 3.4 to 13.4 millimeter mercury column. This means if the lungs is normal, according to the degree of increase in bicarbonate, the lungs can make CO2 retention at least 3.4, at most 13.4. Now actually, the CO2 is 14.8. The average is 14. So after calculation, actual change of the rate of CO2 is 8. To say another word, the precondition is the lungs is normal. The lungs can make CO2 increase 3.4 to 13.4. Now after calculation, actual the CO2 retention is increased about 8, and this is within the range. So it indicates 14.8 CO2 maybe come from the lungs compensation after metabolic alkalosis. So the conclusion is metabolic alkalosis exists. Actual CO2 is not 14.8, such as 16 or 15.8. After calculation is overreach. This data indicates more CO2 retention is not the result of the lungs compensation. What happened? Respiratory acidosis. Now in this situation, after calculation, the actual increase in CO2 within the normal rate, so only one type's acid-base imbalance in the rabbit is a compensatory metabolic alkalosis. Even the pH is a little increase, but other calculation indicate the lungs begin to compensate. Seriously, this is a decompensatory metabolic alkalosis. The last situation is weak left ventricle and make CO2 retention within 1 or 2 minutes. So this is acute respiratory acidosis. Now, you know the lungs cannot be used as a regulation organs in the case of respiratory acidosis, because this acidosis takes place in 1 or 2 minutes, so we cannot use the kidney to compensate. As a result, the main compensation for acute respiratory acidosis is hemoglobin and tissue buffer system. Compensatory formulas. because the blood and the cell buffer synthesis cannot compensate respiratory acidosis completely. So acute respiratory acidosis is serious. This is the blood gas result. The last situation collapse the trachea. After collapsing the trachea, we see the CO2 retention extremely more than the normal rate. So we can diagnose this is acute respiratory acidosis. Now, according to the compensation formulas, when the CO2 retention after the hemoglobin and the tissue cells buffer synthesis, bicarbonate should be increased, but in this situation, bicarbonate decrease. So it indicates no compensation in your rabbit because the bicarbonate, including SB, RBE, decrease. It indicates what happened. Acute metabolic acidosis. Now the evidence is lower pH, AB SBR decrease, BE more minus, AZ is increased. And acute respiratory acidosis, the evidence is CO2 retention. So this is a double acidosis because double acidosis, so pH extremely decreased. Now, what will cause the double acidosis? Acute respiratory acidosis caused by collapsing trachea. Acute metabolic acidosis because we collapse trachea, so no oxygen into the body. And without oxygen, you know this is hypoxia. Hypoxia will make glycolysis. So what happened? Lactic acid overprotection will make acidosis. Now we have summarized about the three situations: ingest acid and ingest the base or make airway obstruction. And we use the formulas to analyze this is a simple or triple or double acid-base imbalance. Actually, acid-base imbalance is a very complicated chapter in pathophysiology. But you know, when acid-base takes place, it will make your patient dangerous and make your patient get worse. So you should know how to identify the type of acid imbalance, and you should know what the cause is, and you know how to treat it. Now finally, I hope everyone can get a good mark in the final examination, and I wish your dreams come true. Thank you.